John. It's massively, I'm really grateful, massively important that we do this kind of thing. The reason why I'm grateful is it's not just myself, it's behalf on the whole of the vaccine injured community, because the reason why I'm saying it's so massive is, I've been injured for 3 years now. It's been pretty severe. I won't wish it on anyone, but we're censored by all the mainstream media outlets, and nobody, wants to speak to us and trying to sweep us under the carpet. So for the likes of yourself and all the work that you do, I just want to thank you for that, and it does really mean a lot to us that you've got me on today to speak to me.
Well, the compliments of any go to you, Adam, for talking about your suffering, because it's not easy, and I've been reading your pathology results from this morning. Now, all of the things we're talking about on this video are attested by evidence from Adam's pathology results and results he's given us. And I will be sharing clips of that. Obviously, for reasons of confidentiality, I can't give too much information, but it is there. I've read it all this morning. I was quite taken aback, Adam, to tell you the truth, but from what I've read. I mean, I'm just going to go through some of it. So you've been diagnosed with what's called a venothromboembolism. So this is like a blood clot in one of your big veins that's gone to your lungs. You've been diagnosed with vaccine-based adverse events. Vaccine damage has been diagnosed. As I say, you've had these multiple pulmonary emboli, these blockages of the blood supply to whole areas of the lung. You've had a condition called ventricular tachycardia, where the heart is beating so quickly, I think in your case it was about 176 a minute, that there's no time for the blood to get back in. And that must make you feel so bad. You've got inappropriate, ordinary tachycardia, like you get when you're exercising, but you get that when you're at rest. You've got something called post-vaccine complement in your muscles. Now, this has been confirmed. So someone stuck a needle in you. Was it in your leg, Adam?
Yeah, it was in my leg. So they cut an inch into my gastrocnemius, so my calf muscle in my leg. Took a good few sort of strands of long muscle fibres, and then the histopathologist had a good look under the microscope, and they've also frozen a bunch of them for the biobank here in the UK.
Yeah. Abnormalities found in that, but one of them was what's called complement deposition in the muscles. Now, complement is the end path of an inflammatory pathway, and the complement will actually damage the cells in that area. It's good to have it for a short time, but you've had it for a longer time, which is bad. Maybe secondary to post-vaccine complement activation was the official diagnosis. Heart problems, you've been recommended for a possible ablation, that's a procedure on the heart. You've been tested positive for D-dimer, that is a test that indicates that there is blood clots in the circulatory system somewhere. You've been diagnosed with pericarditis, the inflammation around the heart. You've been diagnosed with this ventricular tachycardia, it's what's called non-sustained ventricular tachycardia. You've had tests that show you haven't got the traditional disease of your arteries. You have not got coronary arterial disease, which you would normally think about in these situations. And that's been confirmed with computerized tomography, coronary angiography, a scan looking at the blood supply through your coronary arteries. So you don't have the typical coronary artery disease that would be expected with these sorts of horrible cardiovascular compensations. You've been diagnosed with a degree of what we call atrioventricular heart block. So the electrical impulses from the top of your heart are not getting through properly to the bottom. And you've also been diagnosed with some right ventricular impairment and dilation. And the right ventricle is so important, of course, because that's the whole side of the heart that pumps blood to the lungs and receives blood back from the body. You've actually been diagnosed, I've stunned Adam, renal calculi, blockages in the ureters.
Yeah,
and then the whole
completely down the pan, John, so it was normal,
yeah.
And now it's like, borderline stage 3,
The kidney function. Yeah. And the blockages, which of course can be the most excruciating condition ever. common A&E diagnosis. I've seen patients rolling around on the floor in the waiting room with this. It's terrible. And then you've been diagnosed with peripheral neuropathy. Now, peripheral means it's the peripheral nerves, all of the nervous system that's not the brain and the spinal cord, and there's disease of the peripheral nerves. And again, this has been formally diagnosed. It's been diagnosed by the biopsy, the histology. You've had electrical studies, the physiological studies, where people will give a little electrical shock in one part of the nerve and pick it up, and the electrophysiologists can tell what's going on from that. And you've also got some peripheral demyelination. Now, people normally think of demyelination as multiple sclerosis. But the difference is that the multiple sclerosis only affects the brain and the spinal cord, whereas yours is in the periphery. And you've also got facial skin rash. Now, critically, Adam, your spike protein is present in your antibody test. This is after you've been symptomatic for over a year. But your nucleocapsid protein was negative. Now, the nucleocapsid protein is part of the virus that is not generated by vaccine. So people that have had natural infection would have spike protein and nucleocapsid protein. People that